Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Metro Health Director Claude Jacob, and this is our COVID-19 update for the San Antonio community. Let's review this week's progress and warning indicators, and some good news to report. Hospitalizations are down slightly when compared to last week. Our case rate has also shown an improvement, and our positivity rate has dropped to 10.6%. That's a 3 percentage point decrease. The hospital stress score has improved slightly, but remains higher in the higher end of the severe level. So overall, our risk level remains severe. These are some indicators that are now moving in the right direction. Not all of them, but they're starting to move a little bit. So we're pleased by that. Also want to credit the testing that's going on in our community that has helped us to identify infections quickly and get people the help that they needed. Let's take a look at our cases for today. We are reporting 864 new cases of COVID-19. So our 7-day moving average is now 1,131. That's the average daily rate over the last 7 days. We're reporting, unfortunately, 2 new deaths this evening, and we've lost a total of 3,895 people to this virus. These are our neighbors, our friends, mothers, fathers, sons, and daughters, so please keep them and their families in your prayers this evening. Over in our hospitals, there are 1,313 patients in area hospitals. There were 191 new admissions in the last 24 hours. That is still a very high number. So keep that in mind. We take the good with the bad. Let's continue to do the things that we need to bring this under control. 378 people are in the ICU with COVID-19, and 237 are on ventilators this evening. It's worth noting again that 86% of patients in area hospitals are unvaccinated. 27 patients this evening are children. Let me turn it over now to Judge Wolff.
Thanks, Mayor. Yeah, we had a high, I think, of 1,466 in the hospital here a few days ago, and so we're down somewhat, but it's so hard to understand where we're going because in the last 2 days, we've increased 24 people in the hospital, and then, as you stated, we had 191 go in, which is 36 more than the day before, so it doesn't look like this thing has completely stabilized yet, so we're still very, very concerned. And we're very concerned about schools. As you know, the mayor and I have fought hard to require face masks and social distancing in schools, and of course we've been undermined by the governor, and we all know those arguments, and all the data, all the health information from health sources say that we should be doing that. But just to give you an idea of what's happening out in the schools, when you look at the fact that we had statewide 14,033 cases of student having COVID as of August the 22nd, that was a 182% increase over the previous week ending August the 15th. We won't know the new numbers till September the 3rd, but they'll be coming out. That'll be something you probably want to be careful and take a look at. I think there's 4 school districts around the state now, all small ones, that have closed due to COVID, just simply closed the doors. And then I think Monday night, just last night, the Colony School District near Waco with a larger one, 2,500 students, has closed. Their second teacher died from COVID. It just emphasizes that they got to be careful in schools. Of course, got to be careful everywhere. But with students closer together, the children may get it, and they may pass it on to someone else. A great number of people still refuse to get vaccinated, adults, and you would assume that school personnel and teachers may be part of that 20% or so that didn't get vaccinated. So just be careful with your child, and again, I want to thank very, very much the school districts that have stood up, like Northside and Northeast and San Antonio, requiring face masks and social distancing.
Thank you, Judge. And we know you're tired, fatigued of dealing with COVID in our community for well over a year now, but please consider those nurses and doctors and frontline workers who have been having to deal with this and deal with the ramifications of illness and sickness and death in our community for a long, long time. They are tired as well, and we need to continue to help them. And keeping that in mind, we know that Labor Day is nearing. The work that we've seen take place is directly related to the progress that we're beginning to see in some of these indicators. But keep in mind, again, Labor Day is a holiday where many of us spend together, barbecuing, celebrating with friends. And as the indicators in this COVID situation is beginning to see a little bit of daylight, it's more important than ever to remain vigilant in our fight against COVID-19. Plan now and ahead of Labor Day, the holiday. If you are gathering with friends, please try to do so outdoors in a well-ventilated area. Instead of family-style meals, using individually portioned and packaged meals and snacks is always a good idea, especially if you're with those who are not part of your household. That is advice from our Metro Health Department. And regardless of your vaccination status, mask up around others. Wearing a mask is easy. It's the easiest way for anyone, regardless of your vaccination status, to slow the spread. And if you have family and friends who are still unvaccinated, talk to them about the benefits of the vaccine, not only for themselves, but the people around them. Consider taking them to get vaccinated over the long holiday weekend, and you can find a provider by going to covid19.sanantonio.gov. The choices you make over the holiday weekend will determine how much longer this surge of COVID-19 lasts. So please do your part and help us contain the virus. As always, you can get the latest on COVID-19 and find testing locations by visiting covid19.sanantonio.gov, or you can text for the latest information, COSA.gov, to 55000. You can also call 311 if you need assistance in housing, getting back into the workforce, etc. There is assistance available for you. You are not alone. Please remember to mask up, vax up, do it for yourself, do it for your family, and do it for San Antonio. With that, myself, the judge, and Claude are available for questions.
I wanted to ask about the positivity rate. It's about half of what it was just a few weeks ago when it was at 21%, and now it's at 10%. Could you put that into context with the rest of the numbers that we're seeing? Hospitalizations haven't gotten really any better since that same amount of time, and while cases seem to be a little lower, I mean, the positivity rate has been cut in half. So can you put into context why the positivity rate is lower than the numbers that we're seeing on a day-to-day basis?
Fair enough. The positivity rate reflects two data points. It's the number of positive cases over the number of tests that we've administered in that time period. So the good news, as you've heard from the mayor, is that our volume of testing over the last few weeks, we've seen that increase incrementally, which is good. So folks want to know their status. They're going to get tested, especially at our free testing sites across the city. The better news is that we're not seeing as many positives given that total volume. So that's why the positivity rate has been dropping systematically. So we can applaud the schools, the teachers, the students, the universities. So we know that that's an inflator of sorts. To your other question around why we're not seeing the correlation just yet tied to hospitalizations or even our average, our case rate per 100,000, just know that that's one indicator in terms of the positivity rate, but we are pleased to see at least some nominal improvement in terms of what we're seeing with the hospitalizations. Just know that there's a lag in terms of what we would see evident by the other indicators. So great question. We applaud folks for getting tested. It's free, but it also allows one to know their status, especially as we've been paying attention to breakthrough infections and whatnot.
Do you have the current data of vaccination rates, like fully vaccinated and then those who are partially vaccinated? I mean, have we seen that go up over the last few weeks, especially since the FDA announced approval for Pfizer?
Right. So August was and still is, for one more date for today, National Immunization Awareness Month. So we've at least reminded folks that we've been amplifying our messaging, and we've been talking about this since the 4th of July, since we know that we've seen this increase in our positivity rate. We've seen an increase in our case counts over the last few weeks. So in terms of what we're seeing now are those who are eligible. We've shown over 67% of folks who are eligible over the age of 12 to be fully vaccinated. We've shown over 83% of folks who are eligible over the age of 12 to at least receive one dose. We are also reporting out systematically about the percentage of the population that's partially vaccinated. Right now, we're just making sure that folks are aware. We're pleased at what we're seeing in terms of the eligible population, keeping in mind that kids under the age of 12 are not yet eligible to be vaccinated. So that's why we're at it, reminding folks of the value of being vaccinated. We're reporting out, and later this week we'll have the updated figures about the percentage of those who are eligible of the population to be vaccinated and those that have received at least one dose.
That 83% seems like it's a lot higher than it was a few weeks ago for the first dose recipients. I mean, has there been a large increase in the number of people getting their first dose over the past couple of weeks?
Yeah, when you say a large increase, again, this we know that early on we made a dent in this. Obviously, when the vaccine still first rolled out, right now we've seen a tapering effect. Part of what's pleasing to us is that we're still making steady progress for those who are fully vaccinated of the eligible population and those who are receiving at least one dose. So we have made some nominal progress. We're keeping an eye on that. We've been over messaging and over communicating the importance of being fully vaccinated so that folks complete their vaccine series. We've sent out reminders. We've sent out text messaging. We've literally been throwing everything at this. So we're pleased to see the progress. We're not out of the woods by any stretch of the imagination, which is why we're making sure that folks understand the impact that the unvaccinated are having on our healthcare and hospital systems.
You got to keep in mind, I haven't seen any later poll numbers, but those that were not vaccinated, 45% of them said they would never get it. And I don't care what you do to that group. If they're going to continue that way, they won't. And they're getting a huge amount of false information over the internet, and even some doctors, unfortunately, are spreading a lot of lies and misinformation. In fact, there was a report just this last few days that the medical associations around the nation, federation of them, has encouraged states to take action against these doctors. And some states have done that, revoking their license. And that's added to a huge problem, because if somebody's a doctor at all, where they think they're real smart, but many cases like this, they're not very damn smart.
Have any of you heard reports of students not attending classes because of fear of being exposed to COVID-19?
I have not heard that.
Have not heard that. Again, anecdotally, we're keeping track of what we're hearing from parents or teachers or students. So it's not beyond the realm of possibilities that some students would be afraid or hesitant. The flip side of the comment is that we are encouraging folks, for those who are eligible, especially those that are back in school, at least over the age of 12, to get vaccinated. So, but we have not heard that anecdotally, but we'll keep an eye out on.
When it comes to deaths among the vaccinated and unvaccinated, Dr. you were telling me earlier that it's just like with hospitalizations, it's just overwhelmingly people that are vaccinated are not dying from COVID. Could you provide an update on any mental health data of the number of deaths among the vaccinated?
Yeah, again, we've been talking about this for the last few weeks, that this is a pandemic of the unvaccinated. So we've tried to look at some of the data. Folks have been asking about whether or not there have been any breakthrough infections among those who are vaccinated, or have there been any reported fatalities among those who have been fully vaccinated. So we looked at a time period just to compare apples to apples. While we have seen a number of fatalities, a few, amongst those who were fully vaccinated, the caveat is that we also acknowledge that those folks may have had some pre-existing conditions, but just to put a metric on it. So we looked at a time period. We wanted to compare apples to apples. We showed literally half a dozen fatalities that occurred among folks who were fully vaccinated versus over 2,000 amongst folks who were not vaccinated. So it's binary. You're either vaccinated or you catch COVID. I mean, so this is why we've been talking about this, about the importance of being fully vaccinated. But at the end of the day, we're looking at the data, and we at least have some comparative information where we can see the value of making sure that folks really get vaccinated.
Put that to a percentage. I'm not sure. The last one I saw is 99.5% of the ones that are dying are not vaccinated.
Mayor, if I could ask about the situation with Afghanistan, we saw that the Archbishop talking about, or rather, Catholic Charities providing support to some of the people that are coming from Afghanistan. You know, you've talked about San Antonio being a compassionate city. Last week, the city council approved $200,000 for Catholic Charities to help asylum seekers that are coming in. Not sure if that same pot of money is going to be used for this, but you know, I wanted to get your thoughts of potentially up to 300 people from Afghanistan coming to San Antonio.
Well, we are a city that helps and welcomes those who are seeking refuge, and there's no difference here with the refugees from Afghanistan, many of whom have served valiantly our country for a number of years. So we are not yet, to my knowledge, designated, similar to one of the bases in Texas that is receiving many thousands of refugees. But I did get notified by Antonio Fernandez, who's the CEO of Catholic Charities, that they are receiving a few hundred refugees, and we're obviously there to be supportive. I know there's faith organizations, nonprofits that are ready and willing and already helping with the situation, and we'll stand ready to do our part.
That was exactly right. They're really good, hard-working people, and they've stood up for our country, and we should be doing everything we can to help them, and I'm very pleased that Catholic Charities is doing this.
And my last question about COVID, given that from the numbers that we're seeing right now, do you feel like things are starting to balance out? We saw an increase for weeks and weeks and weeks, but now we're kind of seeing similar numbers. So does this feel like that this is kind of a balancing out or a plateau?
One thing we know about this virus is that it keeps us on our toes. And so it would be unwise for us to forecast or to assume that we're out of the woods. We're not out of the woods. Just like we wouldn't cross the street without looking both ways, we must remain vigilant. So what you're hearing tonight is that at least for our positivity rate, for our case rate per 100,000, even in terms of the hospitalizations, we've seen a nominal improvement. But let's be clear, there's still a brush fire out there, and we want to make sure that folks get vaccinated, that folks mask up. But really, entering into another holiday, we want folks to just be extra careful as they're gathering and having fun and just making sure that they are mindful of the fact that this virus is still out there. So we're not out of the woods. We remain vigilant.
I think about where we were last year, maybe a little bit before this time, and sort of feeling like, wow, we just went through a little bit of a wave there and survived. It was pretty stressful for our hospitals. That was right after the first wave. That wasn't even the fall wave, which really got terrible. And it has been invariably true that every time that we as a country or as a local community sort of let up and take our eye off the ball, this thing comes roaring back. And so I think especially as we're seeing schools start to operate, we're seeing very tentative behavior in the economy, that we've got to stay very vigilant right now and make sure that we're doing what we can to put this behind us. The good news now is that we have now the ultimate tool to finally put an end to this, which we didn't have in the previous waves, and that's the vaccines. And that's why it's so darn frustrating that people who are eligible would just refuse to take it, knowing full well that it's not only protecting them, but it's the entire community. When folks get that message, get vaccinated, and then we finally also see the young people in our community be finally eligible to receive the vaccine, I'll start to feel a little bit more comfort in where we're at. But I certainly do not think it's time to take our eye off the ball. I mean, we might go into different phases of health protocols, but we are definitely not taking our eye off the ball of COVID anymore.
You know, we're just sitting here listening to what you were saying, and where we went through the winter surge last year, and now we have Labor Day coming up, and we're still very high on hospitalizations. But I was just thinking, you know, it was only 5 months from now would be 2 years when that first group came here that was out at the Lackland base. It's just hard to believe that, you know, we went through the summer surge, the winter surge, and then this Delta came out of nowhere to hit us, and here we are still almost 2 years later now.
Well, I remember a conversation I had recently, I think with Dr. Wu, or maybe it was with you, Claude, that reminder, this is a global pandemic. you know, and global pandemics last 2, sometimes 3 years. The good news in this one is that we're a lot smarter, I think, and have more technology and tools available for us to protect people's lives. I think in the toll in the 1918 flu pandemic was 50 million lives, something like that. We don't need to see that kind of carnage, but it does mean that we're gonna have to be vigilant and you know, be in control of the situation for the duration.
That's all we have tonight. Thank you.